March is recognized as National Deep Vein Thrombosis Awareness Month or Blood Clot Awareness Month. So this afternoon we have ProMedica's Dr. John Fish with us so we can learn more about DVT. Doctor, thank you so much for being here.
Thank you. Thank you for having me.
Of course.
Pleasure.
So what is DVT and is it different than most blood clots that we hear about?
Yeah, DVT or deep vein thrombosis is a special kind of clot in deep veins. So sometimes we think of clots in arteries where we can get a heart attack or a stroke. You know, a clot can go from your heart, for example, with atrial fibrillation, but not to confuse that with deep vein thrombosis, usually starting in the legs. It can be in the arms too, but usually in the legs, and then that is a clot that then can move and become deadly.
Okay, so who is at risk? What are some of the risk factors?
Yeah, the main risk factor is something that, you know, comes with age. You know, you acquire some type of risk factor either from genetics that you have that you didn't know about, but surgery and injury, those are the main things. So these are acquired risk factors. These are things that happen to you. And so we see a lot of this in the hospital. And the consequence of DVT, when a clot moves to the lungs, called a pulmonary embolism that can cause death, is actually, I just looked on the CDC website today just to check the statistics, but it is the most preventable cause for hospital death in the United States.
Wow. So then is there anything people can really do to prevent this from happening to them?
Yes, yeah. So a number of things. One, if you have a lot of swelling in your legs or varicose veins, using compression socks that help to keep the flow in the deep system so there's better flow. Things that can prevent clots that are medications, aspirin. These are things you have to talk to your doctor about. These aren't things you just go and do on your own.
Right.
But if there's a family history, if you have cancer or other inflammatory conditions, that can predispose to clots as well. So lack of movement, injury, predisposition, and then things such as surgeries that are done that can basically activate the clotting system in your body.
So just like anything else really, just do your best to maintain an active, healthy lifestyle, helps reduce risk.
That's correct.
Okay.
That's correct, yeah. So eating well, not smoking, things of that nature. Being well hydrated. If you're traveling, so you know, sometimes people think of airline flights
Yep.
and having clots. There's not a lot of data there. The recommendations are very weak for being aggressive to prevent clots, but being hydrated on the plane, moving your legs, so doing little ankle exercises as I teach my patients oftentimes, getting up and walking, which is not usually, you know, a good option anymore, but you know, but not being in a cramped space with your legs not bent for 5, 6, 7 hours at a time. So those are things that all can lead to a clot forming. And usually when someone does, you're probably going to ask me about that, but when someone does get a clot, they'll know that they have pain, swelling, redness, tenderness, things like that.
Okay, and I was only laughing because before I asked him off camera selfishly about airplanes and blood clots,
Yes,
so
yeah.
easing my mind there, thank you so much. What are some other common vascular conditions?
Well, arterial disease. So we have arteries, we have veins, and then we have a third set of vessels called lymphatics. So everyone knows a little bit maybe about arterial disease. Peripheral artery disease is something that's very common where you get cramping when you walk, but it can be a signal that you have problems with atherosclerosis or blockage of arteries in other places, like going to the vessels going to your brain or going to your heart. Lymphatics, however, is a little bit less understood by the public. And those are vessels that drain fluid between the cells, particularly the legs. So you may have heard of lymphedema of the legs. And they kind of are like the gutter system of the body.
Interesting.
And when those get stopped up, people get chronic swelling conditions, wounds, and cellulitis. Cellulitis is a very severe form of an infection in your skin. So yeah, those are some of the common conditions we treat in vascular at Jobst Vascular Institute.
And one more question before we let you go.
Sure.
If someone thinks they do have a vascular condition, what should they do? Do they need to act immediately? What needs to happen?
Yeah. Well, it depends on what that condition is and how severe the symptoms are, of course. But for one, talk to your primary care physician. There are oftentimes things that can be done that are very simple with swelling of the legs, with elevation, use of compression stockings, as I mentioned. But if there's a severe swelling and pain, that's something that a medical practitioner should be looking at right away.
Okay.
You know, especially if there's a history of clots or concern about a history of clots, that needs to be evaluated right away because clots can move to the lungs and become problematic very quickly.
Okay, all helpful information, Dr. Fish. Thank you so much for being here with us this afternoon.
Thank you.
Really appreciate your time and obviously talking about something very important. So thank you.
Absolutely.